Prior to beginning any patient testing, it is necessary to ensure that all the reagents and equipment are available. For the analysis of urine, the reagents and equipment needed are the controlled test M strips. For quality control, there are quantimetric urine dipsticks, level 1 and level 2. For the actual analysis of the urine samples, we have the ChemStrip 10A. These strips have chemical reagents needed for each test on an individual pad. The Urichem 1000 is used to analyze the ChemStrips. A centrifuge is used for the concentration of urine sediment. The preparation of urine for microscopic examination requires the following: the patient sample, Pasteur transfer pipettes, COVA tubes with caps, and a urine microscopic slide. Here are the major components of this semi-automated system. The transport tray. The tray carries the strips through the machine for analysis. A thermal printer for patient results, and a display window that shows the commands necessary for analyzer operation. The keypad consists of 10 numeric keys, 4 program keys, and specific function keys, which allow the user to communicate with the analyzer. Maintenance on any analyzer is performed as required. There are daily, weekly, and as-required maintenance tasks. Daily maintenance tasks are tasks that must be performed before and after every run. First, remove the transport tray by pressing the Clean button and discard the strips in the biohazard container. Spray the entire tray with bleach and let it sit for a few seconds before rinsing it with running water. Ensure that the tray is completely dry. Replace the tray in the analyzer and press the Clean button to close the front door. The next daily maintenance task is to wipe down all the surfaces of the analyzer with bleach and water. Weekly maintenance on the Urichem 1000 consists of replacing the transport tray and cleaning the transport plate underneath. To do this, press the Clean button and lift the side door on the left front of the analyzer. Remove the transport tray and slide the transport plate out of the analyzer. Rinse the transport plate under running water. Check that the black strips under the plate are not covered with urine residue. Thoroughly dry the plate and carefully insert the plate back into the analyzer, making sure that the plate slides into the runner. Insert until firm resistance. Replace the tray and close the side door before pressing the Clean button to close the front door. Before starting any tests, you should ensure that the Urichem 1000 is turned on so that the instrument can complete the self-check. When this is complete, the main menu will appear on the display. If the instrument requires calibration, a message indicating that calibration is necessary will appear. Press Enter to begin the calibration process. When the message appears, place the Control Test M strip on the transport plate and press Start. Calibration will now take place. This process takes approximately 2 minutes. Results are printed when the calibration is complete. In a hospital system, the urine samples will arrive at a receiving area, and information can be assessed via the LIS system. However, in this lab, recording of patient specimens must be done manually on a worksheet. In your lab preparation, you will prepare the worksheet, which has the following information: specimen number, color, turbidity, volume, and all of the chemistry results associated with each patient, which are obtained from the Urichem 1000. The first task of the technologist is to record some visual observations on patient samples. For example, the color of the urine can often change from yellow to brown to red due to the presence of hemoglobin, myoglobin, porphyrins, or other substances. Rarely, it may appear green or blue due to bile, or even black or bright orange if the patient is taking certain medications. The turbidity will range from clear to very turbid, and the volume is indicated on the side of the urine container. The sample color, turbidity, and the absence or presence of sediment should be noted. If the urine contains a sediment, it should be mixed into the sample. Once the technologist has completed these observations on all specimens, they are now ready to be prepared for analysis on the Urichem 1000. The first step in specimen preparation is the transfer of a set volume of urine to a labeled COVA tube. It is important to thoroughly mix the urine before transferring an appropriate volume of urine to fill the COVA tube. Discard the transfer pipette in the biohazard container. Continue with the same procedure for each urine specimen. When all the specimens have been transferred, they are now ready for analysis on the Urichem 1000. The first specimens to be run on the analyzer are the quality control, specimens 1 and 2. The light-colored one is the normal quality control, and the dark-colored one is the abnormal quality control. The specimens are run to assess the quality of the chemistry strips. The next step is to enter the identification for the quality control. From the home screen, press ID, and then preload, and press sample 1 as the first quality control sample number, and press the Enter ID button. To enter the second quality control, press number 2, and then Enter ID button. Once this is done, press Start to begin sampling. You will notice that the tray begins to move. Uncap the quality control 1. It will be the first sample to be analyzed by the machine. Dip the chem strip in the quality control, making sure to completely submerge it. Quickly remove the strip, wiping the edge along the side of the glass tube. Wipe the back of the strip on a paper towel to remove the excess urine, and present the strip to the machine when the LED light is green. The strip is picked up by the machine, and you may continue with the same procedure for the abnormal quality control. Uncap the specimen and completely submerge a chem strip into the abnormal quality control. Remove the excess urine by dragging the strip along the side of the tube, and blot the excess on a paper towel. Place the strip on the loading tray when the LED light is green. The quality control results will soon be printed. Quality control results for the normal quality control should all be negative. The results for the abnormal quality control will have a value next to each test. These values should be recorded on your worksheet. Having assessed the quality control, testing of patient samples may now proceed. The first step is to enter specimen identification for each patient sample. From the home screen, press ID, then preload, then enter the ID number, and press the Enter ID button. Continue programming patient samples until the list is complete and press Enter. Then press Start to begin sampling. Use the same technique as was used to dip the chem strips in the analysis of quality control material to test the patient samples. Dip a chem strip in the first sample, making sure to completely submerge it. Quickly remove the strip, wiping the edge along the rim of the tube. Blot the back of the strip on a paper towel and present the strip to the loading tray when the LED on the analyzer is green. Follow the same procedure until all the samples have been dipped and the chem strips have been presented to the analyzer. The results of each sample will be printed as the analyzer finishes testing. Revision of test results on all specimens is an important part of urinalysis. It is key in determining which urines will be examined microscopically. Microscopic examination of urine is done to detect the presence of red blood cells, white blood cells, bacteria, epithelial cells, casts, or crystals within the specimen. Microscopic examination is not required for specimens which the results are all negative. However, it is required on specimens that are positive for leukocytes, nitrate, protein, blood, or the presence of sediment. Urines with these abnormal test results should be set aside and securely capped to avoid spillage in the centrifuge. Centrifugation is required to obtain a concentrated specimen for microscopic examination. The specimens are inserted into the centrifuge in a way to ensure that the centrifuge is balanced. Close the lid of the centrifuge and ensure that it is properly locked. Centrifugation is at 1500 RPM for 5 minutes. The centrifuge will stop automatically after 5 minutes is up. While the urine is in the centrifuge, prepare the microscope for examination of the urine sediment. First, clean and dry the microscope using the lens paper and the lens cleaner. Make sure to clean the field diaphragm, each objective, and each ocular. Now it's time to perform color illumination. Place the slide on the stage and using the low power objective, bring the object into focus. Bring the condenser to the highest position. Close the condenser diaphragm and then close the field diaphragm. While looking through the microscope, lower the condenser until the edges are sharp. Center the field with the centering screws and open the field diaphragm so that the edges are just outside the field of view. Remove one ocular and while looking down the tube, open the condenser diaphragm until the light is about 2/3 light and 1/3 dark. Color illumination has now been set and the microscope is ready for examination of the urine specimens. When the time in the centrifuge has been completed, it is time to decant the supernatant. Remove the specimens from the centrifuge and place them in the test tube rack, being careful not to disturb the sediment. Close the lid of the centrifuge container and return them to their place. Decant the supernatant off the specimen. This is done by slowly pouring the top portion of the urine specimen while retaining the concentrated sediment at the bottom portion of the tube. Follow this procedure for each one of the samples. This process concentrates the sediment for microscopic examination. Decant the remaining samples, making sure to mix the sediment. When complete, the sediment is ready for transfer to a microscopic slide. The slides used for microscopic examination of urine have 10 positions, one for each different specimen. Label the top of each well with the patient identification number. Using a Pasteur transfer pipette, mix the sediment to ensure an even distribution throughout the sample. Transfer the specimen to the slide by placing the tip of the Pasteur pipette on one side of the well. Using a constant pressure, fill the well completely, including the borders surrounding the well, without introducing any air bubbles. Repeat the same procedure for each patient's sample. The slide is now ready for microscopic examination. The slide should be examined with the 10 times objective for the presence of large items such as casts, and then with the 40 times objective for the detection of red blood cells, white blood cells, casts, crystals, bacteria, and yeast. The resource material will be provided for analysis of the different microscopic elements.